you first hear a diagnosis like that, you always have fears of the worst and fears of what he can't accomplish or what he can't do normally like any other child.
Hi there, how are you all?
Here you go, I'll let them know you're ready.
Thank you very much. Ready, Jack?
Yeah.
I'm Jackson Kessler, and today I'm here for an infusion at Nationwide Children's Hospital.
Jackson he's a very, very active child, very into sports. Hemophilia sort of curtailed some of the things that he could do, obviously. I mean, no contact sports, and he's sort of had a hard time dealing with that. After he was born, as he got a little bit older, he started having a lot of bruising, really hard time healing. He was diagnosed at 2, and that's when we started coming here.
I love basketball. It's my favorite sport. I love to play soccer too. I was really good at that, but I couldn't play it because of hemophilia, but hopefully I can keep playing it. Maybe I'll have a comeback, who knows.
A lot of times you do feel like you have to have them in a bubble, and that's been a huge challenge for me.
We here at Nationwide Children's want to make sure that we are always on that cutting edge. What's the newest, best treatment for the patients? How can we get that to them as soon as possible? Jackson's a really outgoing kid. He's really smart. He's really curious. Not a huge fan of needles. In our hemophilia clinic, we are now trying to employ virtual reality as a distraction tool.
I thought it helped actually because it took my eyes off of it. I like it because sometimes, especially when you can feel something, it's right there, and you can just put your hand on it and oh my gosh, I'm touching that.
I always tell him he is the strongest kid I know. We just are thankful that we have this place. There's constantly something on the horizon that the doctors are keeping us abreast on.
It's an exciting time to be in the areas of benign hematology because there's more and more research being conducted. The patient comes here and knows they're getting the best possible treatment. These are the doctors who think about their child's disease all the time.
Jackson, when he was 7 years old, he would come and say, I want to be a doctor. And I say, well, why is that? He says, I see how they help people here.
We will be the place where every child who has a rare or unusual hematologic condition can get the answers that they need.
I couldn't have asked for a better place or better doctors or better care. It's just a special, special place.